Hello, welcome everybody. I'd like to, welcome today. I'd like to introduce myself and also my colleague Joe Knight. I'm Nick King, I'm from Lancaster University's School of Computing and Communication. I'm a business development manager there, and if there's any other business development manager in the room, you'll know that's a fairly promiscuous job title. I tend to work in a number of areas. At the moment I'm working extensively in digital health, but prior to that I've been working quite a lot in Internet of Things, for example, or security. I'll introduce my colleague Joe Knight, who's the...
I have a reader position in the Faculty of Health and Medicine at Lancaster University. Stay over there. And I'm also the theme lead for health at the Data Science Institute, which was recently established at the Lancaster University in September. So I have a background in actually genetics health research, which is an ongoing academic research for me. And then at Lancaster, I'm working with many different researchers in many different capacities who are working in the health sector.
Fancy, could you move it on, Jack, please? Fantastic, thank you. I don't quite know how close I can get to Joe without getting feedback, so I'm probably going to, kind of give a fair buffer. When we were pulling together the presentation, I thought it'd be useful, and we'll try and keep this fairly light, but to have some sort of vision statement. You tend to go to these things and you do see these vision statements. And I've been working in this area now. I'm not a native like most of the people I think probably in the room in terms of healthcare. I've been working now probably about 18 months in this. And the more I've worked with clinical partners, worked with technology developers, the more I've seen consistent themes out there. I think I went into it with a thought process that there was a problem that needed to be fixed, there's something that's broken, and people are somehow to blame in some ways. I think I'll just do a quick straw poll. Who's had a fantastic experience of healthcare provision? I know I have, absolutely. Who's had a terrible one? Be honest, come on. Absolutely. I think we all have that awareness of the system. We all sort of have a headline understanding of where it is, but until you start drilling into it, and probably the audience is a lot more aware than I am, I didn't understand that really, truly, everybody I've met in every engagement really wanted to do good, wanted to do their job well, and cared about their provision, and that was quite staggering for me. What we're trying to do in terms of the people arc within the Connected Health Cities bid for the North West Coast is bringing people together, it's joining people. The more I've looked at working with groups, and we did a stakeholder group for Cumbria CCG, it became more and more apparent that what is actually needed, whilst there is a technology overhead within this, and technology can change and underpin very, very positive change within the service, one of the biggest things is really engaging with staff, engaging with clinicians, engaging with GPs, engaging with social care professionals, engaging with patients, and bringing that group together and enabling change to stick, realistically. That's been one of the consistent themes. And the workshop that we ran at Lancaster, there were a number of different areas that came out of it. The democratisation of opportunity, forgiveness for the term, was a headline strap area that came out of it. And that's allowing people to have a say, allowing people to influence the steer on things, the design of things, how they're implemented. It was fantastic to hear from Keith and Tony, and particularly where Keith was finishing off there, about how do we engage with clinicians. That is where this comes from. The people arc is very much about bringing together groups and allowing people to work productively to have a say in how this is done. That is how you'll get stick, that is how you'll get change, and that's how you'll get sustainability.
Okay, so the people arc, the Lancaster-based people arc has 4 different themes. And so we're going to go into each of these themes just quite briefly today. We've got optimising opportunities for industry innovation. So that's obviously, I think, a fair number of people in the room involved in industry trying to work out the best way we can do that moving forward. We've got unlocking skills of the workforce, and that's going to take various different forms as well, which we can describe. Levering the regional research capacity. And so, again, we're going to talk about how we're going to do that in collaboration with industries and our clinical partners, and linking regional programs.
Thanks, Joe. Business engagement, as a lot of people have talked about, is absolutely fundamental, I think, to having this Connected Health Cities project succeed. It sometimes gets forgotten, I think, in the larger rhetoric, and I think Declan brought us back to it, that it's actually economically driven. One of its underpinning principles is that it needs to drive economic benefit for the region. And again, that's a fantastic driver for sustainability. How we actually do this, or how we actually drive forward that sustainability, is Oh, we've gone forward one, Joe, sorry. Totally sorry. Is drawing on experience that we've had of delivering other regional initiatives. Lancaster and Liverpool have both delivered northwest-wide regional initiatives engaging with business. And what we really want to do is create an interface to speak to those guys, to engage with those guys. This exercise is part of that. And I just again do a straw poll, and forgive me, I'm not going to do this with every slide. But just quickly, how many people have come from business today, from industry? That was my thought. I think that's the most active participatory group. And I think as Keith and Tony alluded to, clinicians actually find it quite hard to get out, very, very hard and challenging to actually get away and attend these sort of events. But we can work very positively with the business community to look at developing and levering existing clusters. This building, for example, the Heath, is part of the North West Innovation Network, which where Lancaster are the secretariat of. There are a number of sites in Merseyside and across the North West, and these are the kind of networks that can actually help drive this change. We can help look at what's out there at the moment, what existing products are in use, how they're being utilised, look at, as you might expect a university to do, to look at horizon scanning new products, the real far-reaching sort of exploratory areas of technology, and looking at really identifying, as Keith was talking about, what is actually needed at the front end, realistically. So working with industry, working with clinicians to help align product development. A good example probably is, on the next slide, Joe, is specifically to look at developing new user interfaces. I think, again, it was something that Keith mentioned, is that just how can you optimize the time that people have to input data out into a system and take it out without just creating an onerous system. I know, working in past incarnations, I've delivered CRM implementations, and nearly always they failed. That's not a reflection on me, I should say. But CRMs are universally just implemented. People aren't consulted, they're just done. And the interface is usually not what the people who are needed to actually drive them want. They're usually too complex, they're usually too rich. What we're really interested in, and Lancaster has a very core competency in HCI, human-computer interface research, is to help people understand how you design these interfaces, to how can they be slick, smooth, and appropriate to that person, not to every person in that trust. They don't have the same thing, they have what's needed for them to get data into the system. So we're going to take on specific activity to look at how we can look at designing technologies with new and intuitive interfaces.
Okay, so moving on from the involvement of industry, we're going to talk about the workforce development. So there's different ways to look at workforce development and lots of different levels that we might be interested in. So some of the people that we're going to be dealing with are in informatics departments in the hospital. Other people are going to be the clinicians who are actually sort of trying to interpret this data. And those different groups of people, even within the groups, obviously have huge differences in their skill bases and even their interest to a certain extent. And so what we need at some level is tailor-based abilities for people to get the training they need. So for example, we might have some tailor-based courses available to people who might be interested in upskilling themselves in their maths. Maybe maths and stats is something they now realise they need more than they did when they were learning it, and we can offer some tailor-made opportunities for people to develop those skills. Or computing. So those ones are kind of immediately obvious, the things that might be important in this area. And then these courses might be credit-bearing, they might be non-credit-bearing. We're trying to create opportunities that will actually suit people's needs rather than definitely surrounded by a, they have to do this master's or that master's or this course and get these credits. It's actually, okay, what do people need and how can we create that? And in order to establish that a bit more clearly, we are partnering with Quanum, and they will essentially do a scoping exercise to identify the approaches and, of course, suggest solutions to this kind of upskilling of this target population. So this target population, like I've mentioned, is diverse in itself, the informaticians, the clinicians, and these solutions, obviously, they need to be effective, they need to be affordable, they need to be scalable. They need to be things that are going to change that population and their ability to engage and the desire to engage with these different areas. And so that's one sort of way to look at workforce development. Another way, moving on, is through master's programs. So clearly we do have a generation coming through with an interest in health data, and this also could be people going back to education, but we've got this new generation going through. At Lancaster we have a data science MSc program available. It's been running already for a couple of years. It has themes in statistics and in computing and pathways, one of which is health, and there are other pathways available, but you know, obviously the health one will be of interest here. And there's not just opportunities in Lancaster with the MSc program, there's some in Liverpool. And the program, I know a bit more about the one at Lancaster, but this program includes opportunities to engage with industries and with healthcare. So each of the students that comes through has a placement either maybe in the NHS or in an industry, and in a data science setting. And so we are hopefully creating a workforce that can step into these jobs, and also engaging the industries and the NHS with the work that's going on to universities. Because essentially if a group offer a project for the data science program, then it creates a link between the academic that would be supervising that student and the industry or the NHS unit. So it brings together the people that we're trying to bring together as part of this project. And so one example of a partner is Hartree. They have special interest in a number of key areas that would be useful for this work, including data visualization. So that's just one example.
Fantastic. This is kind of a logical extension of what I've said before, is looking at linking existing initiatives. I've just got some details there, one that's particularly close to home for us, which is the Lancaster Health Hub, which is a grouping that's led through our Faculty of Health and Medicine that has a membership of 7 NHS trusts, 2 CCGs, 2 Vanguard sites, and a number of universities, one being ourselves, one being the University of Cumbria. But there are other hubs and strategic partners, so Liverpool Health Partners and the Chester Hub as well. A key point of success for us will be engaging with these disparate groups, because in terms of timescales for CHC, we don't have a lot of time. 3 years will actually seems like a very long window. We're actually now 5 months into that 3 years. So we need to work with a partner network. That's how we will create reach and reach a broader audience. So we will work through existing regional initiatives such as the Hub Network to actually carry that out.
Well, that's me. Another area we're looking at, I mentioned, is building the regional research capability. And so one of the ways that we're looking into doing this is that we actually have a cohort of doctoral students. So we're looking for these students to be grouped together. There'll be about 4 of them, so it's a fairly small cohort. They'll be co-supervised between Lancaster and Liverpool. And we've been having a number of conversations and trying to formulate the best strategies for these, which will be beginning in September, to create this cohort that really feeds into CHC. So one thing, for example, is the classic idea of a PhD is that someone would come, and they would go away, and they would do a book review, and they would come back sometime later and produce some results. But actually, that's a radically changing picture, and many PhDs currently are producing kind of a project a year, or even certainly in the computing field, much more quicker than that. So the idea is these students will be come in with a very clear mandate to them and their supervisors to do some modular pieces of work that will feed immediately into the CHC. And we've got a number of different possibilities within the different faculties of Lancaster of ways of interacting between ourselves and Liverpool, and we're exploring many of these. So, for example, there's work in the management school that looks at engaging the health service teams in the use of data of technology. So we've talked about that, the difficulty involving clinicians. Well, there's projects that are already being undertaken looking at this area and expertise in this area. So that's one example. Then we've got a stats department that could maybe look at the data, introduce. We've already, Tony already talked about doing some regression with some different variables. Maybe we could some models with some time series, and we don't want to overcomplicate the data. We don't want to not think about what it really means before we try and throw lots of complex stats at it. But sometimes you can push things a little bit further by using some more sort of sophisticated stats. So that's a possibility that we can explore. And within the School of Computing and Communications, ideas of developing software for capturing, analysing data, and so directly at the interface of the clinical with the clinical researchers. And so we're looking to build research capacity that ties directly into CHC and outputs immediately, and so is extremely relevant within the area of the project.
Fantastic. again, coming on to stakeholder engagement, this is again, you probably picked up there's a consistent theme here. These are just, the next 2 slides, I'm just going to talk a little bit about a couple of the tools that we'll use realistically to help facilitate stakeholder engagement. CTAD, which is an institute that sits within our Faculty of Health and Medicine, has been doing some work with in urgent emergency care in Blackpool, looking at nursing provision. It's a great example of what we term participatory action research, which is actually realistically the same sort of thing that Tony's been talking about. It's about empowering individuals to work within a team, but actually looking at that cyclical development process. So that piece of work within Blackpool represents a good template that we might use to map across, to build in disparate stakeholder groups, to look at an issue such as it could be something like consent, it could be one of the particular clinical areas. We haven't been prescriptive on that. I think that needs to be user-driven. But what it can do is help bring together a wide grouping to look at that problem holistically, to try and define what that problem means, define what it means in its broadest sense. How can people interact with the technologies involved? How do people's career pathways, for example, even influenced by this? This kind of approach takes in that full picture, the full consideration of how clinicians and how relevant stakeholders will be impacted, affected, and benefited by development. It lets them co-create it. Co-creation is something that Lancaster is quite strong in, and it underpins a lot of research, I think, that both Lancaster and Liverpool do. If you actually engage co-creation in its truest form, it's actually quite a messy exercise. It doesn't quite often give you what you want. You have to kind of release yourself a little bit to the audience in that co-creative exercise. That's something that we can do. We can work, and we will work very closely with Liverpool, and we'll also draw on our strengths around co-creation, working with other elements within Lancaster University to deliver action research-centred stakeholder engagement. As I say, that particular project was a year long. We might not look at a year-long project. It would be scoped appropriately to work with the stakeholder group that we're looking at. An example of a smaller sort of technology. Digital think tanks. Now, this is an established mechanism that University of Cumbria have been using very actively. They helped create the Cumbria Rural Health Forum. And the digital think tanks is another example of a mechanism we might use. Small, short-scale, 1, 2, 3-day interactions that just allow people to look at specific areas of interest. In terms of what the work that they were doing and Alison Marshall led, it was looking very much at digital technologies and new digital technologies. So it brought on board the people that were going to use them, provide them, EMIS, for example, in terms of electronic record systems. It brought on board social care, primary care, secondary care, and it brought together that stakeholder group, and it allowed you to do quick and easy evaluations. Easy is the wrong word, but quick and concise evaluations of a project area to allow you to define a larger piece of work. So you could see these two pieces of work might work well together. And these are kind of, as I say, tools that we will bring to the conversation. But what we really need, and it comes back to that Keith was saying, is to engage the community early. This, and I apologise before I even say it, is a contact sport. We need to really have a community that is engaged with us from the get-go. And in order to do that, we need to work through partner networks. So that kind of comes back to, as I say, to previous conversations about how do you as an audience want to work with us. I was so pleased to hear questions about how do we engage. There's a number of touch points in our team. There's a number of touch points in the North West Coast. There's a number of touch points centrally. Just contact us, absolutely. I would do a straw poll to say who wants to participate, but I guarantee everyone in the room would say yes, otherwise you wouldn't be here. Hopefully we haven't dissuaded you. And that takes us to a close.
Thank you very much.